Hello everyone, welcome back to the Awesome Physio YouTube channel. Today we're going to be looking at why am I getting pain in my lower back. Lower back pain is probably one of the most common areas of pain that we see in clinic, and it can actually be quite hard to cover every single condition that can cause pain into your lower back. So what I'm going to do today is I'm going to talk about the most common conditions that we see, how they present, how it might be managed and treated, and also looking for any kind of risk factors or predisposing factors that could influence that condition being triggered. Number one, probably one of the most common injuries that we see is a facet capsulitis, or a spasm or a locking up of the lower back. So what are your facet joints? Your facet joints are joints in the lower back that help us bend side to side, flex and extend. It helps us move the back. What can happen if we've done anything repetitively, or we've lifted something heavy and maybe turned, or we've been at a slightly awkward angle, is sometimes what can happen with those joints is they can feel like they're getting stuck, or they can become inflamed in a specific position. Pain's then triggered around that joint, normally unilateral, one-sided, really specific. And what the body also does, if it gets a little bit stuck or it feels quite sore, is all the big muscles around, so your QL, your rectus spinae muscles, your latissimus dorsi, they also tend to go into a little bit of a spasm as well to help maintain that new position or help guard the area from injury. You can also get it where it comes on insidiously, so if with your work, if you're doing stuff day to day where you're repetitively moving in a really common vector of motion, that can also trigger that pain. So how someone might present when they're coming in clinic is either they're moving okay but they've got really specific pinpoint pain, typically one-sided with a dull ache maybe around that area, or if it's really acute, they might be holding themselves in that position where the body's quite comfortable going into, and as soon as you ask them to go the opposite way, so to ask that joint to move in a different direction, everything gets very guarded and very spasmed around that area, and it can become incredibly sore. What we would look at in clinic is gently kind of palpating and moving to see where the tenderness is. We'd be looking at, if we get you to actively move, where the pain is being triggered. And what we would also look at, which is really common, so I want you to imagine like a firework going off. When pain's triggered in that area, it's also very common to have quite a muddy picture where lots of other stuff can get really sore and tender as well, to help you with that movement. So we would assess your range, palpate all different structures around, give you a working diagnosis of what might be triggering that pain, and then management long term would be to soften that area and to get you back moving. Another key element to think about with facet injury or inflammation or damage is something called spondyloarthrosis. So what can actually happen over time as well, if we've had back pain for a while, is we can actually get wearing down of those joints, which can also trigger pain. So although it might not be such a sudden onset of pain in terms of that guarding, someone might report quite pinpoint, quite localized pain that's been building for a while. So that's something to consider depending on the person's age and the onset. So it's not so clear cut, so you want to look at everyone very specifically. What we also want to consider is where the nerves exit out of the spine around that area. So you think if something's become inflamed and become sore, what can then start to happen is it can aggravate a nerve root, which can give specific pain down into the leg. So this is what I was saying earlier, it's not always clear cut in terms of what's going on, because if something's inflamed and guarded and you're holding yourself in that antalgic posture, we might be firing those nerves, those nerve roots, which can give altered sensation down into the leg. It can give a bit of numbness, a bit of tingling, pain referring down into that leg. Sometimes people report like a burning feeling. And so what we would look at in clinic is assessing all of the nerves to see what's going on. So reflexes, muscle power, sensation over the skin, because what it does is it helps us work out which level of the spine is involved, if it's being aggravated, and to come up with a better plan and management long term. Another very common injury that we might see in clinic is injury to the discs of your lower back. So discs have a really important role in terms of allowing that strength with mobility, but also shock absorption through the spine. So what can happen when we're younger, typically up to the age of 45, we've got good hydration of the disc. So sometimes if we've had either a trauma or we've lifted something or we've done something over time, we can inflame and compress into that area, which can cause either damage to the surrounding part of the disc, the annulus fibrosis, which can cause really specific band-like pain into the lower back over that disc area. What can also happen, if you imagine like a jelly-like substance inside the disc, sometimes that can protrude out with damage, which can be a different type of injury to the disc, which can give slightly different symptoms. So if everything's contained and it's painful, we're unlikely or less likely to have any nerve symptoms, but have a really deep ache across the lower back. If the inside of the disc is protruding out, or if it's come out of the disc, that can start to aggravate surrounding structures, so the nerves as they exit nearby. What it can also mean, similar to what we were talking about the facet, but a slightly different pattern of pain, is you can get band-like pain still, but referral down into the leg. What we normally find with a disc, and again everyone's different, is they tend to be holding themselves in antalgic posture. Normally with pressure, anytime we're bending forward, puts a little bit more pressure onto the disc, which can aggravate the symptoms. But what we found from experience is if we've injured our disc, most movements are painful. So most of the time when we're doing stuff, it can become really, really sore. If anybody's bearing down when going to the toilet or coughing and sneezing, that increase in that intra-abdominal pressure can also typically aggravate that area and make the symptoms worse. But like I said, if it's really acute and it's just come on, a lot of the time most movements are painful and people really, really struggle. So what we would look at in clinic is assessing this really thoroughly, looking to see if conservative treatment is appropriate, or referring on to work out what's going on in terms of the damage into the disc. Another key condition that we also want to think about is as we get older, we call something called degenerative disc disease. So it's still involving the disc, but a slightly different onset. As we get older, we typically have normal wear and tear. So what we mean by that is we naturally lose the hydration of the discs. What then happens is everything gets compressed in the spine. This can lead to stiffness and restriction in that lower back. A lot of the time, people presenting with that lower back band-like stiffness in that area, they normally say when they're using the back, so if they're lifting or doing anything which is loading that area, it can become incredibly sore. What might happen, again, everyone's so different in terms of the picture, is if it's built up over time, initially it might be that actually it's a little bit unstable, it's a little bit guarded, before it then builds up that stiffening. So there's different stages that this can present. What's really important, obviously sharing with you guys today, is what we would do in clinic. We would want to palpate around and see any other structures that are involved, because you think if everything's reducing, we're adding more pressure through there and it's becoming sore. Lots of structures around into the glutes, around the lower back, around the tummy, all the way around are going to be compensating to help you with that movement. So again, we get this lovely muddy picture of what's going on, where it could start in the lower back and then other structures are getting involved. So we want to look at your full range of motion, your power around that area, and seeing again if conservative treatment is appropriate in terms of softening, getting it moving, adding in that strength around that area, or whether there are more appropriate management options for you. Finally, the last thing that I wanted to talk about is just a really straightforward muscle spasm around that lower back area. Like I said when I started, there are a million things that we could talk about and everyone's different, but just to keep it really simple today, what happens with a muscle spasm is if we're overloading an area and that muscle is constantly being contracted and used, what can happen after a while is it goes, right, I've had enough of this. It can fatigue and suddenly go into that guarded position. So it can become really sore. So what people present with is a really antalgic posture. So they might be trying to move away or trying to adapt for the soreness if it's been really painful. So they tend to go into this awkward movement. They typically say that it feels like a dull ache into that area. It might be down the flanks or close to the lower back. What they normally say as well, particularly if it's quite guarded through there and it's very local, very specific over certain muscles, that actually adding heat to the area, so getting blood flow there, can be quite good. Normally they report that it's really sore in the morning, and then the more they move, typically that can feel quite good, you know, getting blood flow to the area, stretching it out. Sometimes though it does need a little bit of a helping hand, so the majority of the time, which is great, it can resolve itself after a while. You get it moving, it tends to relax. Sometimes though, depending on what we've done, if it's been quite a big thing that we've lifted or we've done something repetitively, it just needs a little bit of a helping hand in terms of softening, getting stuff moving, getting us back to that lovely kind of normal midline, that normal comfortable position that you find day to day. And so what we would look at in clinic is either a little bit of osteopathy or physio, maybe a bit of massage as well, just kind of getting the area relaxed. And then most importantly, long term, once we've got rid of the pain, working out why did it come on in the first place, or any advice, any specific exercises that we can look at to prevent that from happening again. So in summary, as you've seen from today, back pain can be quite complex. Everybody's different, so your work, your background, previous injuries, that's all going to be influencing or predisposing different conditions triggered in the lower back. The most important thing initially is either speak to the musculoskeletal expert or your GP and have your lower back assessed properly, get them to see what's going on and test and give you a working diagnosis, give you a really structured treatment plan and advice tailored to your specific lower back symptoms and pain. What we also have once you've had it diagnosed is we've got a range of videos on our channel talking through very gentle routines and movements to get the lower back moving, so that if you want to add that into your weekly routine or your exercise routine, you can really target getting movement into that lower back to improve mobility, improve flexibility, and hopefully reduce your risk of anything being triggered in your back.